Hello guys, we are working on common chronic pain conditions today. This actually should not be a very long chapter. It's just some conditions that you might see out in the field more than others, I guess you would say. So fibromyalgia, I am sure that everyone in this class has known or heard of someone with fibromyalgia. It affects primarily women. The ratio is typically 10 women to 1 male is how it affects. And this is abnormally heightened processing of pain in the central nervous system. I find that often this is misdiagnosed just because they can't find any other reason why what's happening. But I am no doctor either. I just find that it's not always correlating with what it sounds like it could be. But other terms that might be related to fibromyalgia is fibrositis, myofascial pain, post-viral fatigue syndrome, chronic fatigue syndrome, tension myalgia, and generalized tendinopathy. There could be sleep disturbances, headache, irritable bowel, irritable bladder, TMJ pain, chronic fatigue, painful periods, intermittent blurred vision, and short-term memory loss can all be associated with fibromyalgia. And typically there's about 3 criteria that they use to diagnose this. One is a widespread pain index, or a WPI. This is a certain amount of questions that they're asking, and that score equals this amount. It's not something that you need to know. It's just basically a tool that they use subjectively to determine whether it's a possibility that they have it. If symptoms have been present at a similar level for at least 3 months, and if the person does not have a disorder that would otherwise explain the pain, then this is what they would be diagnosed with. Chronic neck and lower back pain. I feel like you'll see this more often than, especially in an outpatient facility. These can be really challenging to treat, especially if there's no structural abnormalities are found, either like a herniation or a tumor. There's nothing structurally wrong with the back or the neck. It can be difficult to treat. Lower back surgeries don't usually result in pain relief that actually increases the pain. What we want to do first is PT, eating right, exercise, chiropractic. Surgery is really tempting sometimes, but it's not always necessary structurally if there's nothing wrong. So we talked about what should be done first. Sorry, I had to pause it for a second. My family came rushing in. Really, it depends on the individual and can be different per person, but typically you're going to find that more lower back surgeries they have, the more increased pain they have. All right. Headaches. Who has headaches? I'm sure there could be a majority of people raising their hand right now. Most headache syndromes are intermittent. It was previously believed that migraines were vascular and tension type headaches were muscular, but there is sort of some debate on that at this time. But migraines, cluster, and daily tension type headaches come from disturbances in the central nervous system. Normally, these are treated by a neurologist or a specialist who's interested in specifically just headaches. I have treated headache patients before. Mostly that was in correlation with neck pain. So it was sort of combined. But keeping a headache diary is one of the best things you can tell your patients. And we've talked about the pain diary before. It's the exact same thing. When are you getting it? How bad is it? What are you feeling? What did you do beforehand? And then that way the doctor or the therapist can see any triggers, whether it be caffeine or pain meds, skipping meals, because I know if I skip a meal, I get pretty hangry. You can also have increased headaches when doing upper extremity exercises. Posture can be a huge thing. You guys are all hunched over your laptops now or your computers at home. And stress, all of those things can all increase your headaches. So it's important to keep a diary to really see when they're coming or going. Interstitial cystitis. This is a painful bladder syndrome, PBS, mostly found in women, and it is defined as associated with stretch-induced hemorrhaging of the bladder wall. There is there's no known cause, but they do say that there's possibly some genetic factors included. But the three key symptoms here that you're going to need to know is increased frequency of urination, both day and night, pelvic pain, and increased urgency of urination. Usually it's diagnosed with a scope that goes into the bladder and looking at the bladder wall and maybe taking a biopsy if possible. You might also hear patients complain of TMJ pain and pelvic pain, which is sort of wild how the body works and how the refer pain goes, because I would have never thought of a painful bladder syndrome having TMJ. It blows my mind how the body works sometimes. Endometriosis. More than 11% of women aged 15 to 44. It's most commonly aged between 30 and 40, and this involves the appearance of uterine tissue or endometrium outside the uterine cavity or the womb. They do not know why the tissue becomes embedded outside the wall. There's no explanation. It's also known that the amount of tissue outside the wall does not correlate in the amount of pain. So the more tissue outside the wall does not necessarily mean more pain. But what you're going to find with here is painful monthly menstrual cycle and pelvic pain. And then some treatments include birth control pills, testosterone, like medications, estrogen receptors. Some need repeated surgeries, but usually the surgeries don't really provide relief. And then there is also some difficulty getting pregnant with this as well. And the last one we're going to talk about today is neuropathies, pain caused by a lesion or disease of the body's sensory system, either nerve damage or nerve irritability. Sometimes you're going to see oversensitivity to this as well. Typically, it's that damage to those sensory nerve pathways that we've talked about before. Some conditions, you're going to find burning pain, numbness, stabbing pain, itching. Those are all those nerve-related sensations that you're getting. You might also call it postherpetic neuralgia, painful diabetic neuropathy, or complex regional pain syndrome, CPRS, also RSD. I find it, I've treated someone with RSD before, and it's actually pretty fascinating. You're going to find the severe pain with light touch, motor weakness, some tremors, decreased range of motion, hypersensitivity, and this can develop after a major or minor trauma to extremities. In this case, he had fallen and caught himself with his wrist, broke it, and then developed the RSD. So those are the only conditions. I told you it was not a very long lecture for common pain conditions, but I appreciate you listening to with me, guys. That is the last one for this book, and we are starting to go into your medical law and ethics book now. So if you have any questions, please don't hesitate to email. I am happy to help, and I will talk to you guys soon. Bye.